listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, fact-finding helps you get to the bottom of your client's health insurance wants and needs. Stay on track with our list of questions that doubles as a rough outline for your conversation. Questions to ask clients shopping for an ACA plan, written by Emily Ryan. When working with a client shopping for an Affordable Care Act or ACA insurance plan from the federal marketplace or their state marketplace, there are a series of questions you should ask to better serve them. These questions help you gain an understanding of your client's needs and what they're looking for in a health insurance plan. As we move through the list, we'll talk about what agents can hope to learn by asking each question and how the answers inform plan recommendation and selection. Question number 1. How often do you typically need healthcare each year? Asking how often your client visits the doctor each year can help you determine if they'd be better suited for a plan in a higher metal tier to have more costs covered as long as they're comfortable with a higher premium. Maybe your client only visits the doctor once a year for their annual physical. Or maybe they have conditions they manage with more frequent visits to providers. They may feel as though the lower deductible and lower copays are worth the higher premium. Question number 2. What is your estimated annual household income? Cost-sharing reductions or subsidies are one of the most significant ways to save money and make marketplace coverage more affordable. Your client's annual household income is one important element of estimating subsidies that could potentially reduce their healthcare costs. Healthcare.gov has a helpful calculator agents can use to estimate client subsidies before deciding on a plan. Remind your client that if they qualify for cost-sharing reductions, they must select a silver plan to apply those savings. Silver plans can be the most affordable options for clients who are eligible for subsidies, and more individuals are eligible for subsidies through 2025 thanks to the Inflation Reduction Act. As you're talking about potential subsidy savings, this is also a great time to remind your clients to reconcile their premium tax credits. Question number 3. How much are you comfortable spending each month for health insurance? Some clients may feel influenced by budget concerns. Subsidies can drastically reduce the amount of monthly premiums they'll pay. However, if they're not eligible for subsidies, clients may feel more comfortable choosing a lower metal tier of coverage to reduce their monthly spending. Catastrophic plans can be an option for clients who are looking for enough coverage to act as a safety net, but don't use health services often and aren't willing to spend more than what's necessary for health insurance. These plans are only ideal for clients who want protection from worst-case scenarios, such as getting very sick or injured. Question number 4. Are your doctors in a particular network that you'd like to remain in? When evaluating your client's current health status and medications, consider if there are doctors or specialists they'd like to continue to see. This can help you decide on a plan with a particular network if your client feels that's valuable to them. Health maintenance organization and exclusive provider organization plans, HMOs, and EPOs limit coverage to a local network of physicians and facilities that typically will not cover out-of-network care, except for emergency medical services. These plans can be more affordable for clients with chronic conditions. HMO plans require a referral from a primary care physician to see a specialist, while EPOs do not. Because of this, some individuals may choose an exclusive provider organization or preferred provider organization plan for added flexibility. However, these more flexible plans are also more expensive. Consider in-network flexibility, coverage, and affordability when your client is choosing a plan. Question number 5. Do you take any prescription medications? Those with chronic conditions or those who take prescription drugs may want to decide between an HMO or EPO plan that has better coverage for their condition. Typically, these plans have more coverage for prescriptions than PPO plans. Question number 6. Have you had a significant life change recently? If your client recently got married, had a child, lost other health coverage, or has moved, they're eligible for a special enrollment period, SEP for short. Your client will have 60 days to select new coverage through the marketplace with this SEP. If they have not experienced any of these events, they will have to wait until the ACA open enrollment period, or OEP, to enroll in a plan. Question number 7. Is dental coverage important to you? Dental services for adults are typically not covered as part of marketplace plans. Some carriers do offer dental benefits as part of their plan, but this is not common and may not be available in all areas. We recommend asking if your client is interested in dental coverage. A supplemental dental, vision, and hearing plan or standalone dental insurance plan may be a great choice for these clients. Question number 8. Do you have life insurance? Think about the other products in your insurance portfolio. Are there any products your client could benefit from, such as life insurance? Life insurance can provide reassurance and protection in case of an accident. Consider this your opportunity to offer other services to your marketplace clients. And if you don't currently offer supplemental products in your portfolio, your sales specialist would be happy to discuss opportunities for adding new products and growing your sales. While this is not an exhaustive list of all the questions you'll likely ask your ACA clients as you meet with them, they are important ones you'll want to make sure you get the answers to. Fact-finding is always a good idea as you move through the conversation. You should be able to get a better understanding of your client's needs. Just keep in mind that you don't have to have the answers to the tough questions all on your own. With Ritter Insurance Marketing, you have access to sales support, on-demand training, and resources to help you succeed with one free registration. You'll find the link to the registration in our episode notes, as well as a link to learn more about our services, the healthcare.gov subsidy calculator we mentioned, and so much more. Thank you so much for taking the time to listen today. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan, script adaptation by Sarah Ruppel, recording and production by me, Tina Lamoureux, podcast design by Urban Rivera, artwork by Vivian Zhao. Follow along with our show wherever you like to listen.